Like I said, I'm glad you're chair. That's why I had to change my hair color. Because I was sitting there the whole last meeting looking at it, and it just looked so bad and ugly. No, I didn't want this color either. I wanted a skin of brown with a red tint, like purple.
All right, good evening, everybody. I'd like to call this Program and Budget Committee meeting to order for July 11th. First order of business is the adoption of the agenda. Motion by Commissioner Birdie, support by Nagovan. All in favor signify by saying aye.
Aye.
All opposed? Motion passes. I am going to read our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. Now we will move on to item 3, hearing of the public. Anybody from the public wishing to address this body? You have 5 minutes. Anybody from the public? All right, seeing none, we will close the hearing of the public. Now we will move on to item 4A, request to approve Macomb County Community Mental Health Fiscal Year 2018-19 Budget and Executive Brief. John, do you want to kick this one off, or are we?
Yeah, sure.
Thanks, John.
What we're going to offer up tonight is the usual and standard presentation relative to the 2019 budget that we're responsible for submitting to the county. And Cynthia Mack, our CFO, is going to go through that in a little bit of detail, give her an opportunity to run through it, and then she'll be able to take questions too. And just be mindful too, this is not a request necessarily for general funds. This is not our general fund budget. It's a responsibility of the county to be able to match us on our drawdown and our Medicaid match and a couple other requests that we have. So I'll turn that back over to Cynthia.
Great, thank you. Good evening, everyone. As John mentioned, tonight the report that I'll be discussing is our budget comparison of the budget from 17-18 that was accepted by the county, and then compared to the 18-19 that we are proposing. I will point out, I'll go through the revenue, I'll go through how it's reported out on the expense side. A few things to keep in mind. The format here that I'll be going over is something that you should be familiar with, at least for those of you that have been part of the board in past years. This is how we go through, and you can see the variances just between the budget. It does not compare actuals as far as where we are at year to date. That is typically how I report out on our executive briefs, as I did in the June full board meeting where we're at with expenses. So this is just comparing budget to budget submission. Another thing to keep in mind is that this will be going to, we have to take a preliminary draft. I'll be taking to this building tomorrow, actually, pending the approval here, knowing that it still has to go to full board, but I will be delivering a copy to County Finance as it's been requested. So with that, if I can just start, the first page outlines our revenue sources and where we receive our funding. With this, again, this is not to debate over what our funding is and the different issues that we have. It is just taking what we're getting and what we're projecting to get, again, broken out into our Medicaid. Again, it's pretty much, to call it anything, it's really bland. There's not really some significant changes as compared to what we budgeted for last year. We look at our Medicaid. We had a very slight percentage change just about 0.83 from what we're expecting in our budget. Likewise, in our Healthy Michigan, a little bit more of a variance there of about a 10% increase in our budget. Where you will see our significant change in revenue funding is in our autism program. Our autism program in the past was a cost-settled contract. So moving into this fiscal year, that's transitioned to be a capitated contract. With that being said, Milliman and their actuaries have actually given those projections as they do with our other Medicaid rates. So feeding that into this revenue, along with hearing that we are taking in more and more autism cases, that's leading into our increased funding that's showing on this sheet here. Other than that, we have, again, these are all on actuarial projections that we're getting from Milliman. And in total, our total revenue funding just for the budget from 183.4 going into our 18-19 budget of 193.8 for about a 5.6% increase in our budget. If you go to the next page, this again breaks out the line items, how we give this to the county. However, when we do present it to the county, how the Board of Commissioners receives this, when I take it over to county finance to simplify this, we actually have to do some type of a crosswalk because how we have our accounts, it's very, very complicated as far as how they roll it in. And so we just try to summarize it here to the best that we can by the line items that would be most appropriate. At the top part, you see the salaries and fringes, the personnel expenses. Again, there's not really a drastic change there that you can see. We're not changing anything significantly. We're all aware of where we're moving at with our staffing and things on hold because of how the system has been. And if I can just step back, actually, before I get into the rest of expenses, when we talk about our expenses and how this budgeting process is completed, I know that there's been some question as far as can we see what the actuals are. Well, again, this report here is just simply comparing budget to budget. However, when we are internally going through our budget process, it's about 5 or 6 of us internally, and depending on the programs within, we all take a piece, and we are actually looking at the 17-18 year to date. And for the timing of this, we had to use our mid-year, which I again reported out at the last meeting. So we take our mid-year information, which is the best that we have to this point, and then we annualize and project based on trends that we're seeing. So we do take that into consideration as we're building this budget. To put those numbers, though, in this report, I would just say I hesitate at doing that. I don't think that that's appropriate because that is such a moving target. If we pulled those actuals last week compared to this week, I mean, just based on how our information comes in, it is such a moving target, it would be dangerous to post that. What we need to do is when the year end is done, like when the final FSR is complete, then we can compare when we have a hard number to compare it to. Moving into the rest of expenses, again, I'm not going to go through all of the individual lines. What I plan to do is just highlight a few of those that jump out as far as the most significant changes. If we look at it by percentage change, the first one that jumps out would be the board per diems. And again, that went up 23.8%. But if you look at the dollar amount, obviously, it's just $2,500. Again, that's taking the actuals. So we took mid-year, what was showing for current actual expenses, and then we just annualized it. Another such one would be the client equipment modifications. And again, that's just seeing where we're at year to date and trending that out. Overall, our total operating expenses, you can see actually we're budgeted last year at 11.5 for 18-19 based on, again, the many things that we are facing and as an organization, as a system, looking to be the most efficient. We're not making any programmatic changes. We're not building group homes. We're not, adding to such. We are looking to be cost efficient, therefore driving down in effort to balance those expenses to that funding that we are receiving. So that budget showed a decrease of roughly $1.2 million, a decrease of 10.7%. On the next page, corresponding to the revenue for autism, goes along with the expense for our autism program as well. Again, we're hearing that we're pulling in more people through the door, therefore our expenses we're anticipating to follow likewise. Our equipment, the very last item on this, is another one. Increase of 66%. Again, over the last several years, we have been very frugal with our spending on equipment. However, it does come to be a time with, again, the data needs, keeping up with security, firewalls, etc. It is time to update equipment. It is time to have to reinvest in some of those licenses, etc. The next page, we simply list out our grant revenue, which again is pretty static. It's the revenue to our expense on the many grants that we have. No big swings there. As far as the specifics with this, again, this is how it breaks out our expense to our revenue, keeping in mind that we have to balance that expense to that funding that we're receiving. What the deal is here, what we're asking and what we need to get approved is this is what goes to the Board of Commissioners. This is what the county needs to have presented in order for that required match or drawdown that is required. And for this year, that's a $3.8 million amount. So that's really what we are looking for the approval of there. That's all that's concerning here to go to the county is their $3.8 million. All of those expenses we need to balance internally and work at covering, again, with the funding that we're receiving. Are there any questions up to this point?
Any questions from anybody? Brian? And then Nick?
I'm just trying to understand why there's an increase with the board per diem.
The only thing that I can say again is because when we look at the actuals year to date, so if there's been more meetings, more committee meetings, more travel associated with that, that's all rolled into that line item.
All right, so I know there's this, or just a backup question. I know there's some board members that don't take any per diem at all. So is that, you still, how do I put this? Is that, you're budgeting for the ones that take the per diem, or does that exclude the ones that don't take per diem, or if they don't take per diem, you still roll them into the fact they're getting it?
It's just the actual expense. So for mid-year, the first 2 quarters of this year, so whatever was included in that. So it would take into consideration right there. If there's a board member that's not collecting a per diem, they wouldn't be hitting our actuals. So we just solely took our actual expense and annualized it.
Okay, so if there's one or more two that showed up to a conference, that would make that jump?
Correct.
Okay, thank you.
Nick?
Yeah, I just had 2 quick questions. One is on the county support. That's gone, the request has gone down, but there's indication in the explanation that we're saying no additional funds being requested to support mental health jail diversion. What's happened to the jail diversion?
Nick, can you, your mic?
I thought I turned it on. Can you hear me now?
Yeah.
Yeah, what happened to the jail diversion program? Is it just static in cost, or is it decreasing, or?
My understanding is that the funding that's available has decreased. There's less. Last year, we actually asked for jail diversion support, and they denied that. So this year, when, again, we're going for that ask, we prioritized, since those funds are, what we're hearing, limited, we needed to make sure we're asking for the appropriate, and we decided to go with the crisis line, and then our discretionary funds.
So, John, are we doing a jail diversion program? And, considering that it's required by the code?
Yeah, certainly to your question, we are required through a PHP contract to do mental health jail diversion. Historically, 3 or 4 years ago, we had 4 full-time employees doing mental health jail diversion. That's all paid out of general fund dollars. You can't expend Medicaid dollars in a jail. And so it's all general fund dollars. So when we hit our challenge with the reduction of general fund dollars, we reduced jail diversion from 4 FTEs down to a half an FTE. And a half an FTE kept us compliant with the contract. Did we get the job done? No. But it kept us compliant with the contract. Did we have money to add in more jail diversion folks? No, we don't on the GF side. So about 2 years ago, we came to this board who approved a request that we go to the Board of Commissioners for an FTE on jail diversion, and they provided a half of a jail diversion. So therefore, we're about 1 FTE doing jail diversion, and that's it. Last year, we asked for another FTE, full-time FTE, and they did not approve that. So what Cindy's articulating here this year, in understanding from the county executive, there's not as much money to go around as there has been historically, that they said be frugal with your ask. And so this year, we are asking for our foremost assurance of maintenance of the crisis center, the discretionary funds, and we just took off the jail diversion thing. We could put it back in. That's why the cover letter to the finance director tomorrow is labeled draft. You know, Cindy Mack and I can go back there and modify that tomorrow. You want to throw the jail diversion person back in there, we can. It wasn't funded last year. Don't suspect it will be funded this year. To your question, we do have, I believe, 1.5 FTEs in the jail doing jail diversion. And so we're compliant with the contract.
Okay. And on the insurance liability, that's just a 2% increase, right? I thought I read it as something larger. That's
Nick, are you talking the 52% increase?
yeah. What? We're self-insured, aren't we, through the county? So that's administrative costs?
What line item are you referring to?
I'm sorry?
What line item are you referring to?
I was looking for, hold on. I had
It's on
it.
the expenditures,
I
the
had it.
second
Yeah, it's
page
under
with,
expenditures.
it's above the equipment non-capitalized. So there's insurance liability and indirect cost allocation.
Yeah, it's 52%, you're right. Yeah, it's on page 3 of 5, so. And it's right under the contract service, right under contract services.
You know, as far as, again, with that, any of those items, we took the year-to-date. So where we were at with our expenditures for 17-18, we just annualized it. So we're coming in for a higher expense right now for this year. As to the explanation for why, I could go back and look into that and let you know where we're at. And again, that would be more of a follow-up. And actually, that's where I was going to go with this, that after this type of a presentation on this budget, as the next set of actuals come out, we'll be doing our next interim report actually in August, so I'd be reporting out in September. But prior to, as we're getting more of our actual numbers, I believe through John and through the chair, if we wanted to set up some additional meetings just to keep current with where we're actually trending, we're definitely open to that.
Okay, thank you.
Joan?
Well, I was going to mention about staff travel too. But I guess I was reading it wrong. Your staff travel went down.
We are again trying to limit and be very frugal in our spending on that.
Well, then I don't think you should increase the per diems in our travel. If you're lessening yours, you should lessen ours. We should watch ourselves travel better. So I
Agreed.
think you should take that out. You shouldn't specify, give us more money for travel. We don't need it. We don't spend all travel money anyway. You show me a budget where we spent it.
Well, the information here is based on the actual expenses from 17-18.
Well, I disbelieve that. I can't see where our budget, our traveling went up 23% or, yeah. And yours went down. And there's more employees and everything.
It's just based on the actuals mid-year.
But I see you have travel expense and board travel. There's two different categories here. One's for per diem, one's for travel.
Correct. Built into that is with the conferences, that's included, mileage is included in that, the per diem rates, from the board meetings that are processed every month.
Well, I see staff's travel is double. I don't worry about you driving me, Linda.
If I can help
Your
out,
staff's travel is very high.
if I can help out here a little bit, when you look at the raw through the chair, if you look at the raw data for board travel, the difference is $975. $975 is the difference. If you look at the staff travel, the difference is around $9,000. So it may be the difference of one conference that shows up a month earlier, then maybe your staff travel costs or board travel costs would be higher. We have hundreds of staff driving around the county every day, hundreds, and we pay them mileage. Caseworkers and sports coordinators, they drive from here to Armada to Richmond, Romeo, and all over, and we pay them, $250,000 to drive around their cars,
It just hit me that yours isn't less.
Pardon me?
Yours is decreased and ours is increased.
I don't think it's to be seen as a we, they. I mean, we're all in this together.
Okay. I'll concede on that, just to bring it up.
And if I can also make mention, again, when we're putting this budget together, right now, this is to go to the Board of Commissioners. As we are working through the year, again, we're responsible to actually manage our expenses, which is what we meet and discuss at every board meeting, and what we can do better as far as such things as what we did with the MORT contract, what we're dealing with the acute inpatient, things like that we're addressing, the programs that we're addressing. With this right here, this budget, again, if I can stress, it's that $3.8 million drawdown from the county that's of the concern tonight. As far as balancing all of these line items, these all roll into that. However, as the year progresses and we see, we actually can make movement within those line items. So if we see we are spending perhaps somewhere less, or we foresee we're going to overspend, we can make those adjustments throughout the year. But again, it's a matter of balancing that to that funding. And the main point here, again, I can't say enough, is that drawdown from the county, and that's what we need to give them what that amount is and get that approved.
Linda?
I was elected to a position at the association, and it's a duplicate, Lou's on the same committee. And so I was going to get off of it at the last meeting, and there wasn't anybody at the breakfast to hand it off to. So I've started, I don't drive, I don't bill to go to Lansing, I just call in. So that would change that actual in the year too. It's a committee I don't need to be on.
Thank you, Linda. Susan?
Thank you, Mr. Chair. So I assume that some of the travel stuff, which is the smallest piece of all of this, but we assume that mileage rates are going to go up too, right? Because we reimburse at the federal rate, right?
Correct.
So you
Every
have
January.
that to consider across the board, no matter if it's, no matter who's driving, right? You're going
Correct.
to have that to consider. So I just wanted to point that out because that's beyond our control. Question for you, because we talked a little bit about the jail diversion FTEs. And I'm curious, because I guess when I was commissioner, I was always under the impression that having a jail diversion staff person actually, even though you expend money to have a staff person, that it actually saved you money on the actual, upkeep and maintenance associated with keeping a person in the jail. So I'm shocked to hear that the board itself is and that the sheriff wouldn't be advocating to get more jail diversion. You know what I mean? It's kind of, I find that reverse logic, right? I mean, we only have one full-time equivalent person doing that when we used to have 4, and have we done any trend analysis of that to make a business case that investment would be wise? Are we doing anything about that?
Well, as a basis, good question, as a basis to the start of it, if you have general fund dollars, limited general fund dollars to be able to support a jail diversion person, then that's how we're going to afford that. And when you're in a position where we are, where we don't have the general fund dollars, it's just not practical or financially possible to be able to afford more than what you can afford. Do we all want to treat the underlying etiology of a consumer who's in jail? Yeah. Should they be, go through incarceration and be in jail for 30 days only to come out schizophrenic, on day 31? Yeah. So we want to divert them. We want to be able to create the diversion and be able to get them back into the mainstay of community and treat the underlying etiology. When they're in the jail, they cost us nothing. There's no money's born to us. I mean, it's not what we ideally we want for our people.
Right,
But there's no money born to us while they're in the jail. I mean,
and on the flip side, it's very expensive for the jail.
Yeah.
Right? I mean, to treat someone that, whether it's medications or whatever, I mean, they have to retain medical services to treat that person, or if they're not treating them and they have to deal with other issues that may come out from, not treating them. And it just seems to me like we should be able to collaborate with the county to have the county, I mean, I understand the general fund pinch, right? But there are some efforts. It seems like we should be able to work with the sheriff to coordinate and have some appropriations from the jail budget to assist with this, even if the savings were shared or even borne just entirely by the, can't the jail, that department retain services from us?
I think they could. There's community corrections who works on jail diversions all the time, and have they subcontracted, the jail subcontracted with us to look at the opportunity for mental health professionals to be in there beyond what they're contracting inside treatment for us to work with diversion. That's a great recommendation. We haven't ever gone there, but I think it's a superior recommendation. We should look at that.
Yeah,
talk
I mean,
with Tony and see if he wants to go that way.
It just seems fiscally prudent, right? I mean, not only is it in the best interest of the recipient, it's in the best interest of our tax dollars to do that, and the staff at the jail even trying to manage situations that might be out of the normal scope of their duties, right? So it just seems to me like we should be pursuing that, and kind of in light of that, it makes me question on, let's see, what page is this? On page 105, where the county contributions, it's the second to the last line, it appears that there is a reduction there to the county contributions. And am I to understand that that is the equivalent of the jail diversion position that you asked for but didn't get last year? That's what that is?
That's correct.
Okay, so when I'm looking at the first column labeled 2017-2018 budget, is that number what we proposed last year, or is that number what the board adopted last year?
The 2017-18 is actually what went to them and was adopted. Now, with that in mind, they still did make that revision to the jail diversion.
So why wouldn't we reflect, so all these numbers, I guess I'm having a hard time, and again, it's probably because I was a commissioner once, but that number, so the 3.994 number that's represented there, isn't representative of what we actually get from the county, because they've revised it.
No, the 3,994 is still what we're actually receiving. That's what's showing
Okay.
on our books for 17,
So that is the final number in the
what we should be
budget.
getting, correct.
Okay, that's not what we proposed last year.
Initially, correct.
Which would have been a little bit higher because we had the FTE, we had a portion of an FTE, right? For jail diversion in there that was declined, so maybe that would have been, 400, 4 million or whatever it was. Okay, so why are we reducing the county contributions? Because I know that this board actually voted to ask the county to give us some money to help us get our funding from Lansing, so I'm surprised that we're reducing their contribution.
If I can speak to that again, it's taking a percentage. There's the 90-10, it's the percentage. And so when you look at what our funding is and what's the requirement, that will obviously change, that will go down. If we look at the historic, and it was actually in the letter that was with the packet, you can see historically for years back what the ask was. And that would align, again, when you're taking that percentage, what they would be required to provide.
Okay, so we've set that allocation to try and do a 10% reduction.
It's all in proportion.
Okay. Is it possible for us to, I mean, I know you have to turn this in tomorrow, so I'm not proposing that we change anything in this. Can we get a trend analysis over time of what the county contributions have been, maybe for the last 5, 10, 8 years, something? That's
actually in the
that's
cover
there,
letter.
okay.
Yes.
So, okay, I apologize. So
It's on,
it's on page, I see it now. I do
it's on
remember
the
seeing it.
narrative, yeah.
I just, yeah, so, I mean, it looks like it's just getting smaller and smaller, and along with the hits that we've taken from the state, it's tough. Okay.
It's, again, part of that is Medicaid, part of that is general fund, and again, that's the required match and the drawdown.
Okay.
She will, Lou.
She was, okay. So you also mentioned at the beginning of your comments, that, the actual tracking is kind of a moving target, and I know the way our business runs and with billing and different things like that, it can have quite a lag before we're seeing numbers in actual. Have you given any thought about how to improve that? Because it's kind of hard to manage a budget when you're
It is, but
lagging.
unfortunately with our system and the claims when they're coming in, I mean, we're tight as it is, but we have claims coming in how many months after? So we run into that problem even with our quarterly reports as far as the information being timely. Like I said, from what we pulled from mid-year, that was for the first 2 quarters. Well, we did not have complete information. It's only as good as what we had that date. So, for example, when we close our fiscal year, the end of September, we're not turning in our final numbers until February.
And even that's probably aggressive.
Correct.
Okay. It's just hard to manage a living document when you've got the, a budget, a living document,
It
when your
is.
actuals are so far lagging. And
It
it's
is.
not a unique problem to the entire health industry, right?
Right.
So, do you think it would be beneficial to do any more trend analysis of actuals for a longer period? Do you do them over 3 years rather than 2 or 5 years? I mean, is there any way to do that to help do a little more projecting?
As far as you're talking about historic?
Yeah.
I mean, it's always something to explore. I know, again, this is my second time through the budget process, and I'm always looking for ways that we could wrap our arms around more accurate information, reaching out. There's system changes, there's, just new developments out there, working with different staff, getting ideas as far as trying to get information out there. Again, we're limited with some of that data, unfortunately, but as far as trending, again, even with what I had spoke to a little while ago, as far as trying to have a meeting as far as throughout the year, more actuals. I mean, it is a lot of work. For example, when we do our actual reporting out for the different FSRs, what goes into that by my department is very intense, a lot of data. And again, it's moving constantly. Can we look at that monthly? Somewhat we can. And again, with the use of some of these data systems, the improvements with the FIA information that we're working on, that was again part of the goal. The more information we can get, more timely, more accurate, it'll help, especially in cases like that. That's an example.
Okay. All right, thank you.
Kathy on the first round.
I do. And I think it was answered. It was in line with what Susan was asking. I'm good, thank you.
Nick?
Yeah, going back to the jail diversion issue, Susan's put her finger on it, but part of the problem we have here is that it's sort of the silo effect. We see jail diversion as a cost in our budget. The jail budget sees it as a savings. That's why when we initially did the jail diversion program, started up the first one, it was done through the Human Service Collaboration Board, which I think maybe we should try to get them to revisit it. So the suggestion of going back to the sheriff, who's got some interest in this, not only financial, but has publicly stated his interest in jail diversion and worked at the state level on it, is worth exploring, because cutting that program is penny wise, pound foolish. It saves money to this budget, but to the overall county budget, it actually ends up costing money. So maybe the county commissioner on this board may want to relay some of that concern to his colleagues, and John, maybe you should relay some of that to the collaborative board.
Yeah, I'll certainly, as the chair of the Human Services Coordinating Body, I'll certainly do that. I'll bring that back up and have some discussion with them. I also want to remind the board that there was a comprehensive assessment, year-long that assessment that was done by the group out of Colorado in regards to all of the ailments and opportunities for the jail, and out of that 90 or 120 page document, CMH is represented and referenced on page 2. The underutilization of utilization management, of jail diversion, post booking, and so everybody understands that. I think it's just it needs to be a mutual interest. It means it's an interest of ours, because again, without being repetitive, I would like to treat the underlying etiology of the consumer's condition in the jail. I would like the jail to think similarly. So, and that hasn't.
I'm just suggesting that the overall cost to the county is the final line, I would hope, for the county board of commissioners, but because it shows up as an expense here and a savings there, our budget doesn't show the true savings of the program unless the two budgets are looked at together.
Lou?
Actually, when you're speaking of jail diversion, you need to include the prosecutor's office. They have skin in the game, and frankly, probably more than the sheriff's office when you look at the overall concept of what jail diversion actually is. So frankly, the prosecutor ought to be a stronger reference. The sheriff just keeps people in captivity. Actually, providing services is really very limited when you look at the law enforcement aspect of it. The jail diversion is taking a consumer and putting them someplace other than in jail or other than being prosecuted for a crime, providing services that defers that situation. The prosecutor is really your stronger arm here from a County Board of Commissioners aspect.
Thank you, Lou, and thank you, John, for mentioning that jail study. I was gonna do that, but you beat me to it. So, any other questions or comments? Brian?
Just, I want to make a comment. Want to, for Board Member Linda, I commend you for not going down there and spending that extra money to go down there when Lou can bring back the information. But if my memory serves it correctly, when we were at Elizabeth meeting, we had discussion on the same thing about going to the conferences and everything else, and we were going to send one representative from the board, or two, I think it was two at the time, to go to these meetings and bring back the information to us. And quite frankly, it's the overall picture, the money's minute. It don't really make anything. But I think for the aspect of what this board is supposed to be about is the consumers, what we're taking care of and helping with. And I think that we should go back to that when it comes up again, that we should go down to just sending the minimum people to go to these conferences or these meetings that have to go, and leave it at that to save some of this money that goes under per diem, which I understand, again, I'll reiterate, it's not a whole lot. But on the aspect for travel for staff that's taking care of our consumers, that can be shifted over to the staff to take care of these consumers like it should be. So I just want to put it in thought, and hopefully we can do something with that. Thanks.
Thanks, Brian. Anyone else? All right, seeing none, I'll take a motion to approve. Who are you pointing at? Linda, did you have some?
So, I'll
Lori,
make a
did you have
motion.
some? No? Okay.
Make
We
a
got people
motion.
pointing at everybody else. Yes, Kathy.
I'll make a motion to approve the requested amount and send it to the Board of Commissioners. Actually, full board for approval to go to the Board of Commissioners.
Motion by Kathy, support by Brian. All in favor signify by saying aye. Aye. All opposed? It moves on to full board. Next item is item B, Macomb County Community Mental Health Office of Substance Abuse, fiscal year 2018-19 budget. Does the celebrity want to come up and talk about it?
I knew something was going to be said about that. Here, you're signing autographs and selling the picture. I would. Nobody wants them.
All right. I'll start off on our revenue side. Again, it's the same thing. We're comparing our adopted budget, which was sent to the county last year, to the budget that we're proposing for the current year. And I will start off, we did take it to our SUD Oversight Board this morning, and they approved the PA2 and local fund dollars, which is what they need to approve, with the recommendation that the rest of the budget be approved by this board. Okay. Our Medicaid and Healthy Michigan dollars, basically what I look at when I'm budgeting them is I do a historical trend of what our monthly membership is and then the costs that we receive per member. There's fluctuations in that, so I account for the fluctuations from month to month, and that's how I come up with our budget for the following year. So it does have some relative basis on it. And when I look at the budget for Medicaid, actually, it is a 19% decrease, not an increase like it shows here, because again, this is comparing it to last year's budget. It's actually a 19% decrease from our projected budget for the current year. And Healthy Michigan is actually a almost 10% decrease from our projected revenue for the current year. Our block grant dollars is a significant difference because when we did the budget last year, we didn't have the RFI grant or the state targeted response grant, which were significant dollars in that budget. And obviously then during the course of the year, all these things transpired. So that's why it looks like such a big difference. Now, when I did do the budget for next year, I did incorporate the state targeted response amounts that's budgeted through May. And then after May, starting with April, because the grant ends at April 30th, we use in PA2 dollars. Same thing for the RFI grant that we had received this year. It ends at the end of this fiscal year because that is a fiscal year grant that follows our fiscal year. We're planning on continuing some of these programs, so again, that's using our PA2 dollars for them because we're not anticipating the grant dollars. Now, what I did not incorporate is to talk about the new grant, the SOT. This is like alphabet soup here already. Grant, which is supposedly coming down because at this point, when I'm doing this budget, I don't know what the dollars are. I don't know what the restrictions are. I don't know what programs they're going to, require us to implement. So they're not included in this budget at this time. When we start getting some official word from the state, then we can make an amendment to our budget. So the biggest difference on our revenue source is really our PA2 dollars and not the general dollars that we're getting every year, because that stays pretty much the same, but the amount that we're taking from our fund balance. This will be the first year we're projecting to take like 2.2 million from our fund balance. And I mean, we have ample funds in our fund balance to cover this. And again, and that is mostly to maintain programs that were started from these various grants. On the second page is all of our expenses. Salaries and wages, we did, eliminate one FTE from our department. And the basic increase that the county provides us. So they give us what they're proposing, which is a 1% no bonus next year, and they provide all the fringe benefits amounts, as well as the insurance liability cost. That's all sent to us from the county. I'm not going to go down through it line by line because you've had this already. So the biggest change is really our contracted services, because all of our programs are contracted out to different providers. So you see a significant increase in that. And again, that's for all this extra grants that we had received and these new programs that have been started within the last year. Then after that, you have for us is the budget breakdown by each of the different treatments, like case management, what we're spending for methadone and medically assisted treatment, our detox program. And you can see we've definitely have increased our peer recovery programs. That has been growing. That was actually part of the grants, was expanding it into the hospitals. We're expanding into another one, McLaren Hospital. We've added the drug court. So a lot of these programs were expanded within this current fiscal year. And I did provide you with two graphs. The first one is showing you our funding sources, where most of our funds are coming from. Again, block grant is at the 30%, and the PA2 dollars this year would be at 26%. And the very last thing is the grant showing a comparison of the expenditures. And again, this is by categories where you can see how we've really increased. Again, you can see the biggest increase from last year to this year is in our peer recovery and recovery homes. Anybody has any questions?
Anybody with questions? No? Joan?
No, I just want to say that it's good that you're using all the hospitals around here for our peer recovery. And a good article in the paper about your finances.
Thank you.
Thank you. And your staff is traveling very low.
Any other questions or comments, board members? All right, seeing none, I'll take a motion to approve.
So moved.
Motion by Joan, support by, is that Selena? All in favor signify by saying aye.
Aye.
Aye. All opposed? It passes. Thank you very much. Next item is Lease Agreement A. We'll go one at a time.
Move to, what do we do?
Yeah.
Move to approve.
Support.
Motion by Joan, support by Kathy. Is there any questions on this one? All right, seeing none. All in favor signify by saying aye.
Aye.
Aye. All opposed? Lou is opposed. Next item, motion passes. Next item is Lease Agreement B. Take a motion to approve. Motion by Brian, support by Susan. Any questions, comments? Lou?
Don Carroll.
Hold on one second. Lou's asking a good question. Where in Warren?
It's on Carroll. It's on Carroll Street in Warren.
Jones got you covered, Lou.
I've been there. Yeah.
And it's whose? Where is it?
On Carroll. Carroll, C-A-R-O-L.
Is that where it is?
It is, I'm sorry, Joan, it is not on Carroll.
Well,
Thank you very much. So I'll ask my tongue-in-cheek question again.
Thanks, Lou.
In Warren, is this group home?
It's on Gilbert.
well, I knew it was, boy, you can't.
It's on Gilbert, Lou.
Thank you, TJ. Where on Gilbert?
I don't have that information readily available.
It is an interesting challenge, isn't it? It's a 34.5 square mile community.
Lou, please address me. Thank you.
Thank you. It's a 34.5 square mile community. And the question of where in Warren? I represent the city of Warren and have politically for years. I'd like to know where this group home is.
Okay. Thank you, Lou. Your concerns are noted. Any other questions or comments from the board? All right, seeing none.
Oh.
Kathy.
Thank you. If you look at the owner's name and do a search on the BSNA for your city, you can find the address.
If I what?
Take the name, we have the name of the owner, and look on the BSNA for the city of Warren. That's the assessing and tax information. You can find it.
No, that's his address in Macomb Township.
I said, look at his name.
She's saying you can look it up using the name.
You can look it up using the BSNA, using the owner's name.
What is the BSA you're referring to?
That's the assessing and tax online software that's used by the city of Warren and most of the communities in Macomb County, and state of Michigan for that matter, for their billing of taxes and water and other services.
Somehow I don't think so, but that's okay.
Kathy, are you all set?
I am.
Okay, Susan?
Thank you, Mr. Chair. Am I correct in saying that if I needed to know the address of this property, I could have called the board office before this meeting and the address would have been provided to me? Is that correct?
Yes.
Thank you.
All right, seeing no other questions or comments, we have a motion and support for Lease Agreement B. All in favor signify by saying aye.
Aye.
Aye. All opposed? Lou is opposed. Motion passes. Next item is Lease Agreement C. I'll take a motion to approve. Motion from Susan, support from Joan. Any questions or comments? Brian?
Just curiosity, why is all of a sudden now we're going by the townships instead of the streets? I mean, we had a big argument going on, discussion about that we're putting out the addresses on the website to where they're at, the homes that are up here. Now all of a sudden we're going by the townships that they're in? Because this one says Clinton Township.
They've all been like that.
That's how it's,
Not included a house address, the street name, and the parcel number, or lot
when we decided to redact them months ago, this is how they've come to us. No comment. All right, you have any other questions, Brian? Or are you all set? Okay. All right, seeing no other questions or comments, we have a motion and support. All in favor signify by saying aye.
Aye.
Aye. All opposed?
The next time they show up, you better believe it.
All right, motion passes. Next up, Lease Agreement D. I'll take a motion to approve. Motion by Chris, support by Susan. Any questions or comments? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Lou is opposed. Motion passes. Yep. Next item is item G, approval to notify Macomb County Community Mental Health Provider Panel Network of 12-month specialty services contract extension. John, is that you?
Yeah, I'm going to turn over to Christina Mazzella. As you know, Christina's been our business management director for a few years, has the helm relative to managing and procuring our provider contracts, and I'm just going to turn it right over to her and explain what the board had prior approved, and then where you're going with this. Thank you.
Back in March of this year, 2018, we did have board approval to do a 12-month extension on the specialty service contracts. So what you have in front of you tonight is just a listing of the vendors, and then I'll give a little detail to how the vendors were approved or recommended rather, and what our process is for there, and then what our process is going to be to extend those contracts to those vendors should you approve it tonight. So first I'd like to tell you what you have in your packet. Your first attachment A is a list of all of the vendors that we are recommending for the 12-month extension. Your second item is the cover letter that will be going out to each of those vendors. Next item is the signature page that we are asking that vendor to sign and return to us. The next item is what we call the Section A or Provider Profile application. And just to give you a little detail of what that is the document that they will receive through our secure portal. They will complete that document to give us all of the information that we need from a primary, secondary contact, who their CFO is, who their compliance officer is. It requires information on accreditation, insurance, licenses, hours of operation, language, etc. So this is where we really gather the bulk of information for that provider, which the business management division would utilize to keep our Focus electronic medical record updated. It also has a signature page attached to that. And the last item is the provider disclosure form, and that is required to be completed annually. So all these items are going to go into that vendor portal except for the letter, which would be mailed to those vendors to inform them that the items have been uploaded, what their password is and user ID, and to go ahead and explain what this process is going to entail. There are no changes to this contract. There's no state requirements. There's no mandated changes that we needed to pass through. So this extension really has been something that's going to allow us to manage this contract, make any changes that we need to for the next contracting year. Because there was no state mandates, we thought this was in the best interest so that we could pay close attention to the contract and make appropriate updates for 2019. So the vendors that you have in front of you, the process that business management goes through in order to monitor those contracts is a couple different things. One of the components is auditing. So they are being audited throughout the year, and they're actually audited by different divisions. Compliance does audits as needed. ORR, Office of Recipient Rights, will do audits as needed. Business management, in conjunction with our quality division, will do audits as needed. We will do checks with the Office of Inspector General. Those are a requirement for us. We do an annual review of the finances, and that is something that has to be submitted to us from the vendor, completed by a CPA. We also have something called a provider monitoring meeting that's held monthly. Through this process, each division participates. We meet and discuss each provider twice a year and more as needed. So there is a list that everyone is provided ahead of time so they know which providers we're going to be discussing. And then if they're not on that list, but there's something pressing that needs to be brought to the attention, we can address it at that time as well. And from that meeting, business management division with the contract managers will go forward and take any action that's necessary, whether it's providing technical support, whether that's initiating an audit, or working to have them do a performance improvement plan, or whatever the need is. We will take it from there, and we have a 30-day turnaround, and then we report back to the group at the next meeting what our findings were and what our resolution will be to that situation. So all of these things are happening kind of in conjunction throughout the year, along with quarterly provider meetings. It's mandated that they attend. It's in their contract. We do a lot of provider meetings really outside of just that one. That's kind of the finite one, but the contract managers are out at the sites and doing other types of audits and reviews, providing that technical support that's needed. They're on the phone constantly with the providers. So we do have a lot of oversight and partnership with them. So this list that's provided to you, all the vendors included have gone through all of these processes, and we are supporting and recommending them for the 12-month extension. And that kind of covers the first bullet on your board action request. Is there any questions specific to that?
Lou?
Is this now the current list, or does this reflect providers that we have dropped?
This is the current list. However, if you'll see down on the board action, we're going to go over a couple other providers, and these ones are not on that list.
So this is the firm list going forward if approved and incorporated?
Correct.
Thank you.
Any other Joan?
I see on the list you have Henry Ford's Hospital in St. John's. What about McLaren? Don't you use that?
They do not have a psychiatric unit.
They don't have one.
They do not.
No other place besides the two hospitals on here.
There
And
are some of the hospitals actually have a DBA, so the doing business as for a name, so you might not identify them right off the bat looking at the list. We are contracted with Havenwick, Harbor Oaks, all of the St. John's locations, multiple Henry Ford locations, Stonecrest Center, that's a DBA, and Behavioral Center of Michigan. So we actually have several hospitals, all of Macomb County hospitals we are contracted with.
they are on here?
They are, correct.
Okay.
If
Thank
you need something after, going through with their DBA, I can provide that to you.
Okay, thank you.
Kathy?
So just to follow up to what you just said, there are services available at McLaren, but it's not under the McLaren name?
No, McLaren doesn't have a psychiatric unit, so we would not be in a contract arrangement with them. The people that we serve may go to McLaren because there is an ED, but they won't be placed there. So should they need overnight, or if they need us to stay in the hospital for multiple days, they're going to go through our access center and find a hospital that has a psychiatric unit, and they're going to be supported in a transfer over to one of those.
Great, thank you.
Selena?
Anything else?
At this time, I'm going to abstain from voting on this since I do work with one of the providers.
Thank you, Selena. And you had some more to go on, right? Okay.
Yep, that addresses the first bullet point.
Thank you.
So if we go down, our next bullet point is in regards to Macomb Oakland Regional Center, or MORC. And they're not on the list, but only because, as we have seen at other board meetings, we're in somewhat negotiations with them. We're making some modifications, and so you'll get that one in the next coming months. So it just wasn't ready to go for tonight. Next one down is Centaurea Healthcare, and that was mutually and amicably agreed upon to not go forward past the 9/30 date. Henry Ford Health System, same scenario, only with the emergency psychiatric program, the EPE. They have sent us notification as well to no longer go forward with that program. And I'll go to St. John's is the same, and then I'll explain that. So same scenario there. And the reason for that is the services that are provided in those EPE units is really something that should be and is being paid through their primary insurance or straight to the Medicaid health plan. The codes utilized in an emergency department are not open to the PIHP. So those bills are now going over to the Medicaid health plan, or if there's a third-party insurance, and so they no longer need to contract with us for that service. So they're still going to support those that we're serving in those ED needs as any other ED, but we just don't need to be in a contract arrangement with them. The remainder of the contracts with those two hospitals stay intact. This is just the EPE components of those two contracts.
Any questions? Questions or comments? All right, seeing none. Okay, Selena?
Christina, I understand that we're not going to renew the Centaurea contract. What happens to the kids that are being serviced with them beyond 9:30?
So we've had providers that we have not contracted with, or they have terminated the contract, and we have a policy that we have to follow. So we have to notify the families and the people that are working with them, case managers, supports coordinators. We have to notify the network within a number of days, and then we will go into partnership with Centaurea to look at all of those cases and to assure that they have a warm transfer over to a contracted agency within the time frame and no services lapsed. So we've begun those discussions, and we'll work with the other ABA providers to make sure that there's an ample network. In addition to that, and I'm glad you brought that up, because another thing that business management is working on is we have the RFP ready to go. We previously approved an RFP for autism services, so that's ready to be released. And then we've had some meetings with some ABA providers, so at the next meeting, you'll be seeing me bring forward contracts to increase the ABA provider network.
Thank you.
Linda?
What number of children are you talking about with the Centaurea contract? How many need to be moved?
120, I may be off a couple numbers, but right around 120.
Absorbed into the system from other places?
Correct.
And that's going to be, you're going to be able to accomplish that by September?
We're going to work hard to. I believe that we will, because we do have other ABA providers, and we also have other ones that are interested in contracting with us, and they're going through the audit process and reviewing them so that I can bring them in front of you and see if there are providers that we'd like to contract with as well.
Thanks.
All right, seeing no other speakers, I'll take a motion to approve. Motion by Susan, support by Joan. All in favor signify by saying aye. Aye. All opposed? And Selena abstains. Motion passes. Next is updated MCCMH MCO Policy 9-630, fingerprinting, photographing, audio taping, and one-way viewing. John? Motion from Joan. Is there support? Support from Chris. John?
This is brought to you kind of quickly at the request of the Director of Recipient Rights, and also in collaboration with the Policy Administrator, Kimberly Cope, who wasn't here to present tonight. Really, if you turn to page 5 of 7 on page 91 of your packet, the only change in this particular policy was on item L, where it says photographs and then fingerprints was put in there, and then read through the end of that line where it says used for treatment, identification, or research. That's the only change to this entire policy. So we felt that being the case, that we could run it through the board real quick.
Thank you, John. Any questions or comments on this? Susan?
Thank you, Mr. Chair. Through the chair to John, I'm just curious, I remember hearing a recipient rights case once where somebody had submitted some audio recordings. And so how would that fall into this policy? I mean, would we retain that with the recipient rights case, or would we, after the case is heard, would we dispose of that?
You know, I'm going to defer to the content expert on that question. So, Mark, can you answer that question for us? Yeah, sure, thanks.
Yeah, I mean, I'm just curious thinking about that, because I certainly agree with the policy, because I understand some of the security concerns, but I just didn't know how that would come about.
We don't typically get much in some ways of audio or video, but occasionally we do. Those are maintained as part of our case records, and they are secured in our file cabinets. But we have to maintain them as part of evidence because they are evidence of an investigation. So we do maintain them, our records are maintained with regards to the storage retention requirements of the department.
Okay, so thinking of that in light, I mean, I don't have a problem approving this policy, but can you just take that issue back and make sure that that's covered in here?
Right, but the mental health code really talks about providers. This doesn't pertain to our investigations. It pertains to providers recording. But again, for us, it's evidence. So we maintain evidence in our records, and they're maintained as part of our records.
I don't disagree with you, but I think our policy needs to state that you know, we're gonna, if it's
Right.
not contained in this policy that,
Right.
that as a part of our requirements for recipient rights under the code or whatever, will comply with what, you know what I mean? I think it has to be,
I will tell you, Susan, that the department has very strict requirements for our policies, and that's why the changes are coming forward. The department basically tells us what has to be in our rights policies, and it needs to mirror the code, and that's what they do.
I'm not arguing with you.
Okay.
I know that they do that. I'm saying that you don't want to have your department policy, this, what we're approving today, not reference that to say that that supersedes.
I'm not sure how it doesn't. We maintain.
I'm not going to argue
Okay.
with you.
All
Just
right.
take it back and we'll discuss it offline then, because I just know that when you have documents in conflict, that's where the attorneys come on site. And I understand that the reg is going to supersede,
Nothing
and all
said-
I'm asking is
yeah.
that it be written in here.
Okay,
that the
but nothing says that the records have to, the information has to be destroyed. It does not. So it's maintained, and if you go through the requirements of videotaping and audio taping, you can destroy it after the use is no longer needed, but our uses continue to be needed because it's evidence and it's part of our investigative findings and it's still subject to appeal. So we
Okay.
do maintain them. So we're still subject to the same rules, but we're not required to destroy it.
Any other questions or comments? Brian?
How will this affect with the issue we had a few years ago, maybe 4 years ago, with one of our, I got brain freeze, one of the groups that we were working with, vendors for what I'll say, and for vendors, that they were using a recording device in the main lobby and they were filming in the general areas. How would,
So for hospitals, the law changed, so it does permit the use of video surveillance and has very strict parameters and outlines the security provisions. That's not contained in our policy because the hospitals are not bound by our policies. So the hospitals are required for recipient rights. It's a statutorily created rights office. They're required to have their own policies. So if you look at the contract and our policy, the hospital follows their own set of policies. We do review their policies to make sure they're compliant with the code. I review them. And so I've recently, over the last several months, been sending the changes to the hospitals, but they're required to have their own policies. And their policies include the rules around video surveillance. Ours would not.
okay,
Because it's not permitted.
all right, thank you.
Any other questions or comments? All right, seeing none, I have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is updated MCCMH MCO policy 9-160, qualifications and training for recipient rights staff.
Do you want me to take it?
John or Mark?
Do you want me to take it, John?
Yeah, since you're there.
Okay.
certainly.
Since you made the trip.
All right. All we added was, instead of clarifying all the requirements of our training requirements in the policy, we have just added the contract attachment to the policy because they do tend to like to change and play with that quite a bit. So it's just easier for us to add the attachment than it is to constantly change policy language. So our requirements are now contained in attachment A of the policy.
Joan?
This is, this is just for the staff, the training for the staff.
For the right staff, yes.
Yeah, it's not for our consumer, I mean, the other, the helpers, the
No,
aides.
No, this applies only to recipient right staff.
Thank you.
Any other questions? All right, I'll take a motion to approve.
So moved.
Motion by Joan, support by Kathy. All in favor signify by saying aye. Aye. All opposed? Motion passes. Item J, updated MCCMH MCO policy 6-001, release of confidential information, general.
So the state updated, they completely revised their policy requirements. Fortunately, again, these are the only 3 changes we have to make. So they want additional clarification regarding disclosure to attorneys. So this is just basically, it's a cut and paste from the administrative rules into our policy. So it's just the language around releasing information to attorneys.
And that's for staff.
Yes, but it's verbatim from the administrative rules.
So move.
Motion by Joan. Support by Brian. Any other questions or comments? All right. Seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. All right, next item is receive and file. We have none. Resolutions, we have no resolutions. Other agenda items. John?
I have one. You know, it is the interest of a few of the board members to perhaps, and I'll defer this back through the chair. I'll throw it out here tonight, and maybe we can discuss it more thoroughly at the full board meeting. But I know we talk about services a lot, and that's what we're here for, is to deliver services to people. What gets a lot of attention is money, you know, and finances and budgets. And the big ticket items, I don't believe are getting the attention that they need. You know, it's good to talk about staff travel and those types of things, but the big ticket items are not getting the attention that we need. And I do know through some of the contacts that I've had with some of the board members is that we need to look at what are those big ticket items that are expensive to us, that some of them are borne by the responsibility of administration to fix, and some of them really require board governance to fix. So we can continue to be financially solvent and move forward. And, you know, throughout 18, we're not out of 18 yet, and now we're going to, you know, jump into 19, which is, you know, 2.5 months away. So again, I'll defer to the chair. It may be possible for a few discussions, opportunities to discuss tonight. Put it on an agenda for the full board meeting on the 25th, whenever that is, for consideration that how do we proceed forward on some of those things that maybe we should spend a whole lot more time talking about. So I'm going to stop comment right there, but I think I've opened up the floor a bit.
Thank you, John. Does anybody have any? Brian?
Well, since you mentioned that, John, have we heard anything from the representatives about that $7 million?
We received $1 million. The budget was signed for $1 million, and I believe that money is going to land on the general fund side. So again, and perhaps Nick will have an interest in this, when we sent the document back to Diana Farrington's office. I haven't shared it with the board, but I had to send a document back to Diana Farrington's office that says where you're going to spend that money and how you're going to spend it. Even though we lobbied and advocated for $7.5 million to go into our internal services fund, in working with, you know, the county exec's office, that the mandate come from the county exec's office, that it may be better positioned for us to not tell the budget office that we're actually going to take that $1 million that we received and stick it into internal services fund, put it in the bank, and that we ought to use it. And I've had a couple board members that say, well, if you get additional funds, why don't you use those funds? So the way I have written it up and sent it back to the state budget office is that we're going to use, of that $1 million, about $266,000 for the crisis center. So I'm doubling the ante. I know how important the crisis center is to the board. If the county exec or the board of commissioners doesn't support the $266,000 on the crisis center, I'm doubling down my bet, and I'm going to get it out of that $1 million that the department or that the legislature offered up. I've also asked for the $255,000 or whatever, the numbers might be a little off, but you get it, on the discretionary funds, non-discretionary, discretionary funds that Cindy Mack spoke about. And I also asked for the jail diversion person too. So the totality of that $1 million, I take that back. It didn't go for jail diversion. It went for acute psychiatric inpatient. I'm misspoken there. So anyway, those three areas I asked for: crisis center, non-discretionary, discretionary funds, and then to help offset our general fund costs related to acute psychiatric hospitalization. So now we'll wait and see. You know, they may give it to us on the Medicaid side, or sometime I would suspect in September they're going to give the CFO a report back that'll say, here's your $1 million grant, and it lies on the general fund side.
Well, thank you. I've been reading the email you sent out. I just wanted
Yeah.
Lou?
John, is it possible to convert it to Medicaid dollars? You'll double or triple or quadruple it if you could. And if you're talking about using it rather than supporting the ISF, converting it to Medicaid dollars might get you $5 or $6 million in the conversion. So if you're going to use it, have we thought about that?
You know, it's a good question. You know, since our last meeting, when we had concern about where CMHA was, Community Mental Health Association was, and being able to continue to advocate for Macomb County funding, that type of thing, there's been a number of emails and conversations and phone calls with Bob Sheehan at the Board Association. Now, you know, he's very ardent on the fact that, you know, we should be able to turn some of those general fund dollars back into Medicaid dollars, and that's where he's at, and he's offered to meet with us, and he wants to meet with us. He's even said if a board member or two wants to come, I think he wants to try to help us out, and if a board member or two wants to go meet with Bob Sheen, a couple of my staff, you know, we can go do that. My concern is, though, is that we went after those Medicaid dollars, and for the last 2 years, the department said, look here, your Medicaid rates are certified by, or they're driven by the Medicaid Milliman actuarial. They're sent from the department to CMS, and CMS certifies the rate. And because your rates are certified, and they're not going to be recertified for a couple more years, your rates are what your rates are. And so that's been the argument that I believe, from my perception, and I'm always, you know, interested in learning more, that the Medicaid rate is what the Medicaid rate is. And so what we received in that $5 million a year ago, that was a general fund grant. It was a general fund grant. It was not Medicaid. But if I'm willing to learn more, if we want to go up and I'll take Sheehan up, I told him we were going to meet tonight at the board. If we want to learn more, and if he, you know, wants to lead that effort, let's take him up on it. How do we turn those general fund dollars now into Medicaid? Because I think he's making a contention the $5 million can become $17 million. All right, let's, you know, he's a smart guy. Let's make it happen. So if any of the board members want to go up and meet with Bob or bring him down here and have that discussion, and how does that actualize, I'm all in. That's your question.
Any other questions or comments? Sounds like we're in for a meeting with Bob. We'll make Bob travel to us. We'll make Brian happy. All right, nothing else from any other board members? John, you all set? Okay. All right, we will close other agenda items. Next is hearing of the public. Anybody wishing to address this body from the public? 5 minutes. Give us your name, address. We can listen, we can't respond, but staff will get back to you.
My name is Ramon Kelly. We drove down here from Saginaw, Michigan. I represent Charles and Rose Kelly Open Arms. I'm the director there. I also have Ms. Joyce Rivers. She's formerly of Saginaw County Community Mental Health Authority. She's our quality developed staff person. And I brought a couple of our consumers. I refer to them as my family, as my nephews. The lady name escapes me, but everything she was talking about providers, we've been through it because we've contracted with Mental Health Authority, with Saginaw County. But we are now in the process of expanding. And I spoke with a few representatives in our home county, and Macomb County came up. I spoke with legislators. I've been down in Lansing, and they feel that it's time that we expand. We feel that it's time that we expand as well. What we are a therapeutic treatment home. We don't use the term group home too much because we're a family home. I've heard you guys speak about jail diversion. That's kind of what we do, and we teach life skills. A couple gentlemen that you have before me, they were on our margins. They could have went to jail, could have been in somebody's penitentiary or someone's graveyard. They're both employed. One is on his way to college. And Nick is here from, I think, Bad Axe? Yeah, Bad Axe. So, this is our family, and we teach them family values. Reason I brought them here, too, because I also teach them democracy, and we teach them how public policy works. And these are future, I believe, board members. On somebody's board. I've sat on a number of boards. But we do things like We eat together. We go camping together. Teach them etiquette. I don't care where they sit politically, but I do teach them to be engaged in their community, to know what's going on. I teach them eye contact. We teach them eye contact. We have a lot of evidence-based things that we use, but some of it is intangible. Some of it you can't get in a book. Again, Nick here is on his way to college, and Michigan State, hopefully, my alma mater, go white. And Thomas Booz here was at Hawthorne. We had a couple kids who were at mental institutions. And the story of their life was kind of wrote that they'd be in adult foster care, or they'll be in Saginaw County Jail, so on and so forth. And I've worked in residential for years. So has my brother. So has Joyce. And we came together and said, there's a way that we can stop this, because we've worked in some of those group homes, some of those residentials, not here to impugn any residential or any other facility or anything like that. But when we would see years later, some of those same kids were either dead or in jail. So the diversion that you guys speak of, we wanted to get it early, at its infancy stage, and teach them a quality of living and how to make proper choices. And this works so far well with Saginaw County Community Mental Health, but we are looking to expand. And I will let Joyce speak briefly, because I know we only have 5 minutes. But again, I just wanted to, prior to, we do have the provider profile application in here. We do. It should be at their desk probably tomorrow morning. But again, it's important that I bring our youth up here to kind of see how things work and populate them in areas that they're not accustomed to. And sometimes, I'll be honest, some of our city councils and stuff like that, I like to bring them to us. Our senators have been in our home, and we've had dinner together, lunch together, but I make sure I populate them at the table, because they need to know what that looks like and what that feels like. But I'll turn it over to Joyce here briefly.
Good evening. I was a wraparound coordinator with Saginaw Community Mental Health. I recently retired in November of 2017. And the thing that got my attention with Open Arms, it was a newly opened facility, but what we did, okay, I referred one of my youth to that facility. Okay, sometimes you have to get the youth out of the home. You know, sometimes you just need a break from each other. You know, you still love each other, but you just need that break. And so that's what Open Arms provided. Okay, we had the meetings, the wraparound meetings, the child and family team meetings at the house. You know, we brought in the staff at Open Arms, but we also had the therapists available, the parents, the teachers, principals. They all came to the house. So it wasn't like we took the youth out of circulation. You know, everybody was there. So Open Arms was very supportive. Okay, and we also was able to get the youth out of the environment. A lot of times the kid needs to get out of the environment. You know, sometimes it's a matter of life and death. For several of the youth that I work with that I had placed in Open Arms, that was the situation. They would not have survived. And so Open Arms was that getaway. It was also the supportive environment that the youth needed. Ramon and staff, they made sure that the youth went to the doctor appointments, they went to court appointments, and so it was just a all-encompassing support system for the youth. And they also learned how to have a sense of family, because the house is run like a family situation, like a family environment, and so sometimes the youth did not have that in their home. You know, the parents were also encouraged to learn how to listen to the youth without becoming angry, because the frustration level is so high. You know, you work so hard with your youth, and the frustration can be so high because you want them to hear their frustration level is high. And so it's a very emotional situation. And so with Open Arms, in this neutral environment, they were able to come together at this big table in the dining room, you know, and we were able to develop plans. We were able to open the lines of communication up with the youth and the family. And so Open Arms is a really positive, it's a really strong program, and it's really, really needed. Our youth are suffering, you know, and we're trying to keep them out of detention or jail or suicide. And with open arms, the staff is inviting and they're supportive, and they have a sense of family there. I'm really glad that I was part of Open Arms when I was working for Saginaw Community Mental Health, because it was a really big help. It really was. So thank you.
And I'll just let Nick speak briefly, and then we'll head back to our seats.
Hello. My name is Nicholas Lord, and I can really attest to what he said about the diversion, the jail diversion, because I was on my way to being locked up, and they accepted me in December. I was gonna be locked up, but Open Arms let me come in, and now I'm currently employed on my way to college. Got my license, working on getting a second job. Really focused. They helped me learn a lot. I didn't know how to cook. I know how to make nachos and everything now. So it's a very good family environment, just because everybody, all the residents there, are from different situations, but we all learn how to come together. It's amazing what me and him been through, and how we bring it together, like all from different family situations, all from raised up in different life, but that's a lot of different moods together, but we put it together and make it work. And it's like he said, he calls up nephew, and that's Uncle Ramon. But yeah, it's a really great program.
Thanks, Nick. And I'll just say this before we head to our seats. We teach love, because some of these, it was hard for, I know Thomas, I tell Thomas, I love him. He said, what, you love me? So especially, we have a girls' home that we're opening up too, but we teach them how to receive love and how to give love back. And all these things that we give them, we do hold them accountable, and we have high expectations. The same thing my father and mother raised me, that's all we're doing. We're not reinventing the wheel or anything like that, but we teach them how to receive love and how to give love. And thank you all for your time. Appreciate it.
Thank you. And you're going to need those nacho making skills in college. They helped me out, I'm telling you. That too. Anybody else from the public? All right, go ahead, Jeff.
I just, want to thank you for coming down. Saginaw's a long way, and I'm just so inspired and appreciative of the fact that you came down here and told us about your program, and hopefully we can do business. I would love to see more and more providers out there do the kinds of work you're doing. Just great stuff. Thank you.
Thank you, John. Anybody else? Nothing? All right. I'll take a motion to adjourn. Motion by Susan, support by Selena. All in favor signify by saying aye. Aye. All opposed? We are adjourned. Have a good night, everybody.